Once again, I am Jamaira Usman, presenting the last topic, which is the respiration and acid-base balance. First is the respiratory acidosis. This is a decrease in the rate or efficiency of respiration, permits excess of carbon dioxide to accumulate in the body fluids, resulting in the formation of excess H plus ions, which a lower pH occurs in severe pulmonary disease. So, ang respiratory acidosis is a condition siya that occurs when our lungs can't remove all of the carbon dioxide produced by our body. And nagkukause siya sa ating blood and other body fluids to become too acidic. Next is the respiratory alkalosis. So respiratory alkalosis is an increase in the rate of respiration increases the CO2 exhaled, which decreases the formation of H plus ions and raises pH. And it occurs during hyperventilation or when first at high altitude. So the respiratory alkalosis occurs when low carbon dioxide level disrupt your blood acid-base balance. So this is normally occur in people who experiencing uncontrollable rapid of their breathing, and this is treated by supplemental oxygen and therapies to reduce the risk of hyperventilation. Third is the respiratory compensation. So, the respiratory compensation is the physiologic mechanism to help normalize a metabolic acidosis. So, this is a modulation by the brainstem respiratory centers, which involves altering alveolar ventilation to try and bring the plasma pH back to its normal value. Ang normal value ng ating pH is 7.4, and in order to keep the acid-base balance in the body, the respiratory compensation must function. And the respiratory compensation is categorized by respiratory compensation for metabolic acidosis and respiratory compensation for metabolic alkalosis. So, in respiratory compensation for metabolic acidosis, it is increased in respiration to exhale CO2 to decrease H plus ion to formation to raise pH to normal. And the respiratory compensation for metabolic alkalosis decreased respiration to retain CO2 or carbon dioxide to increase H plus ion formation to lower pH to normal. Next is the effects of pH change. So, in acidosis, it depresses synaptic transmission in the CNS or the central nervous system, resulting in confusion, coma, and death. And in alkalosis, it increases synaptic transmission in the CNS and the PNS in the peripheral nervous system, resulting in irritability, muscle spasms, and convulsions. Next is the disorders related to the respiratory system. So we have two major disorders, which is the COPD or the chronic obstructive pulmonary disease, and the second, the lung cancer. And we have third major disorder, which is the asthma. So we have 6 disorders related to respiratory system, and first is the chronic obstructive pulmonary disease, which is characterized by an irreversible decrease in the ability to force air out of lungs. And patients with this condition may become a cyanotic as a result of chronic hypoxia. So, ang COPD is parang group siya ng diseases na nagkukos ng blockage sa airflow natin na nagkukos siya ng breathing-related problems. Number 2 is the emphysema. This is characterized by permanent enlargement and destruction of alveoli, and the lungs lose their elasticity and expiration becomes an active process. So, ang emphysema is one of the diseases that comprises COPD. So, ibig sabihin ito yung siya yung nagtitrigger para mabuo ang COPD. Ang emphysema kasi is nagde-develop siya over a time and it involves gradual damage. Nagde-damage siya ng paunti-unti sa ating lung tissues, which is specifically sa ating alveoli, and which causes the formation of COPD. Number 3 is the chronic bronchitis. This is characterized by excessive mucus production in the lower respiratory passageways, which severely impairs ventilation and gas exchange. So, ang chronic bronchitis is inflammation and irritation ng bronchial tubes, and kaya nagbi-build up yung mucus is because because of the irritation of the tubes. Number 4 is the tuberculosis or the TB. This is an infectious disease caused by an airborne bacterium and mainly affects the lungs. So, ang TB, pwede mo siya makuha from person to person through air. For example, nahubuan ka ng taong may TB and pwede ka mahawa nito. Number 5 is the asthma. This is a reversible obstructive condition caused by an immune response. So, ang asthma is a disease that affects our lungs and it causes the patient or yung mga taong may asthma na makaramdam sila ng hirap sa paghinga, ubo at saka yung paninikip ng dibdib nila. So, this is normally occurs in children, sa mga bata, and of course, pwede rin magka-asthma yung mga older people. Number 6 is the lung cancer. This is promoted by radicals and other carcinogens, for example, the vinyl chloride and the benzene. So, the lung cancer begins in our lung and can spread to our lymph nodes and our other organs to our brain. And that's all for our topic, which is the respiratory system. Thank you for watching and listening.